The following program is a Town of Colonie television production of the William K. Sanford Town Library. Welcome to Getting to Know You. My name is Joe Nash. Today we're going to be talking about Equinox in Albany. It is not just the place that does the Thanksgiving dinner every year. It is a nonprofit community organization. Here's something that I didn't know. It's they have over 11 locations. They have over 200 employees. They serve 5,000 people a year. And we have with us their CEO, Dorothy Cucinelli. Thanks for coming.
Sure, my pleasure.
Now, like I just said, is that a common perception? Do people know this when they think of you? They think it's just the turkey dinner on Thanksgiving, or?
Yeah, well, we are really very well known for our Thanksgiving dinner, and we're happy to provide that to the community as a service. We serve 10,000 dinners every year on Thanksgiving Day, and our unofficial motto is we're not just turkeys. We do have a lot of other services that happen 365 the rest of the year.
Well, you have a lot of services for substance abuse, chemical dependency, domestic violence, mental illness. You have a lot of youth services for youth. You have something called Great Finds. But since May is Mental Health Month, we're going to concentrate on your services for mental illness. But before we talk about that, just give an overview of all your programs that I just mentioned here. You have a lot going on down there.
Yeah, we do have a lot going on. We have 4 basic service areas that we like to think about when we think about what Equinox does. And the first one is the mental health services, and we're going to talk about that more today, but essentially it's a spectrum of services, everything from outpatient clinic treatment to a more intensive sort of a day treatment program to residential models where people can have anything from a supervised setting to a very independent apartment with some minimal supports. So there's a spectrum there on the mental health side. The second service area that we have is a substance abuse clinic, and it's an outpatient clinic in which we treat everything from teens to adults, and it can be people who have been arrested for DWI violations. That's where a lot of people come to us for that issue. The heroin epidemic, any kind of substance abuse addiction would be a condition that we would help someone with in that program. The third major area is our domestic violence program. We operate the only domestic violence shelter in Albany County. It's very, very busy, full almost every day of the year, sadly. A lot of people coming to us for help for that. Support services go along with that. And then the fourth major area that we have are the youth services, and that's really 2 different branches. One is a shelter for kids that are runaway youth, so they could be running from a violent home situation or an otherwise unsustainable and unhealthy situation to any of the reasons why kids, want to run away from home. There's that shelter. The other piece of that programming, though, is what we call our Youth Outreach Center. And it's a teen drop-in center for kids, high school age and middle school age. It's a place for them to go after school, a safe environment for them. We have some services that we offer there as well. So it's really those 4 areas that we have: mental health, substance abuse, domestic violence, and youth services.
Of the 4, are they all a bunch pretty equal with clientele, or is one larger than, is one more, have more clients than others?
There's it's hard to, we do track the statistics, of course, but one of the interesting things that we find is there's a lot of crossover. People go from one program to another. We find that our staff often know people very well as they go from program to program. Some people are enrolled in more than one program. For example, often in domestic violence, just because of the nature of being involved in that situation, a person can have depression, they can have, other mental illnesses, and so they might be seen in our clinic as a patient there. Another example would be the substance abuse clinic. and the mental health clinic work very closely together. Those two are called co-occurring disorders in the field, which means people often have one and they have the other as well.
Okay.
Sort of the way that that's thought about is people with a mental illness, and I'm going to say depression again because that's so common, will often what's called self-medicate. So they'll use alcohol, prescription painkillers, for example, to kind of take away the pain of the depression, and that's how they become addicted.
Okay,
so they often go together.
So well, a lot of these things do cross over.
Sure.
So your mental health services. What I've been reading all your stuff here. What are some of the services you offer for mental health, and what are some of the? I guess there's a wide range. Well, talk about what the services are first, and then you can talk about the different mental illnesses you guys deal with.
Yeah, the outpatient clinic, I'm going to start there. We have a very active outpatient clinic. We serve about 650 people a year. We're licensed for 500, and we are licensed by New York State Office of Mental Health. All of our programs are licensed by the state, which is sort of an indicator of quality for the public. But we are licensed. We operate a very busy clinic. We have board-certified psychiatrists on staff, which is not something that every clinic has. They are really experts in their field. Nurse practitioners as well that do prescription medication prescribing. And in that clinic, what happens is, as I said, it's an outpatient setting. So people come there just as you would to any doctor's office. It's the same. There's a waiting room. You check in. You go see the doctor or the therapist. You check out, kind of thing. But what they're treating there are people with serious mental illness, which would be major depression, schizophrenia, and bipolar disorder, which used to be called manic depression.
Okay.
So those are the three major categories.
And people
of
can
illness.
just walk in, or?
Well, we try to accommodate walk-ins. It is kind of hard for us to do that because there is such a need for mental health services. There's a huge shortage, as you probably know, and we're pretty busy all the time.
Okay.
And we are one of the largest clinics in the county. So walk-in capability at this point is very limited. Usually what happens is someone will be referred to us, and you can what's called self-refer. In other words, you can call yourself and say, I'd like to find out about the clinic. I think I need help. What can you do? And we have our admissions counselor who will, walk with someone through that process. But it's usually a referral from another doctor, from a hospital, from a school, for example, that gets someone to our door.
Okay, and then I notice on a lot of in all your programs, not just this one, but a lot of you seem to stress the services aren't just for the people coming, but for their families too. That seems to be an important part of
that's actually a very important part of the treatment. There's a lot of research data that supports the value of having a family support, and you can define that very loosely, from a blood relative to just someone who is very concerned about you personally. But that extra support really makes a big difference in terms of the person's ability to recover. People do recover from mental illness, with the right treatment. So it isn't, something that cannot be treated. It's very treatable. But having the support of people around you is very important.
Okay.
We do have a family support program, and that's intended for the people who are the family members of the person with mental illness, because when you have someone in your family who is suffering from a mental illness, it's very stressful for the family. And what that program does is try to help those family members cope, try to give them some tools so that they can help their loved one, and bring about the best outcome for both.
Okay, and then how do people get in, besides being referred? They can just go to the website, or?
Sure, they can go to our website. It's Equinox Inc.
That'll be on the screen here.
Inc is important, .org, yeah. But they can go there. There's a lot of information about our programs there.
And you're not, you're a nonprofit group, right? You're not a state agency or a county agency?
No. We are licensed by the state, as I said, by several different state agencies, but we are not a state agency. We are a private, not-for-profit. We're a 501c3.
And now one component of a lot of these services for the mental health you offer is on these residency programs. Could you,
Yes.
I think you have you have places all over, I guess, a lot of... Can you
Yeah,
talk about that a
we
little?
have 80, we measure them in this field according to the number of beds. So
Okay.
these are all beds that are in Albany County, and it's close to 90 that we have. They're different types of setting designed to help people who have different needs. So they range from what's called a congregate setting, where you have many people living in a house. It's kind of like a dormitory in a college. Shared meals, but everybody has a separate bedroom. There's that setting. There is an apartment setting. We have an apartment building in Albany County where there are staff on site 24/7, but each person living there
has their own apartment.
Correct.
Okay.
They have basically a studio or a one-bedroom apartment. And then we have a number of apartments that are in the community that we rent from private landlords. And again, we have staff who are working with the people in those apartments to make sure they're taking their medication, help them with their bills, make sure they're paying their rent, that they're being responsible tenants.
Are they on site too, or?
These are in the community. The staff are on site in some of our other office locations, but they visit those people in their apartments on a very regular basis.
So there's various levels. By the time someone has their own apartment, are they they're sort of getting better, or is that the right words to use?
It really depends on the personal preference, and the ability. And again, we come back to that support. What kind of support do they have? It's a very individualized decision.
And at these residential, the services you offer, what kind of treatments or counseling do they get there? They have a wide range of...
Yeah, in a residential program, we're not doing treatment in the sense of, we don't have the psychiatrist that I talked about earlier, we don't have the nurse practitioner, but what we do have is we have trained staff who are counselors who work with people in those apartments or in those congregate settings to develop basically goals, life goals, to help them figure out what they want to do. Do they want to work toward getting their own apartment? Do they want to work towards going back to school? Getting a job, and figuring out how you're going to do that sequentially. So it's a process. It's a series of steps, but it is not a treatment in the sense that we're not doing. We're not prescribing medication. We're helping people make sure they remember to take their medication, which is very important. But we're not prescribing.
Do some people, when they're transitioning, can they still be in one of these residential services and have a job? Or?
Oh, sure. Yes, and we do have a number of people who do have jobs in the community, and we really like to help people. One of our programs, in fact, our day treatment program, has a component that is geared just towards that, helping people get jobs. The rate of unemployment in people who have a serious mental illness, I'm not talking about what we would call the worried well. I'm talking about people who are very disabled. I mean, that's the term that's used in the field. People who are very seriously depressed, who they can't get out of bed in the morning for days and weeks on end, for example. The rate of unemployment in that group is over 90%. It's very, very high, and that's just because they are really unable to work. They are disabled. There's a myth, there's a stigma, with having mental illness, and that's part of the difficulty that people with that illness face. It's mental illness actually has a physical component to it that people don't recognize. When you ask somebody, how are you feeling, and they have a mental illness, they will report whatever their symptoms are. They'll say, I'm hearing voices, or I'm feeling very sad, or whatever. But what they often also report is, I have aches and pains, or my stomach hurts, or there are physical manifestations of that disease. So it's not all in their head, which a lot of people think. It is a very difficult disease to deal with, and the stigma out there is just pull yourself up by the bootstraps and all the rest of this and get over it. And it is a biological, chemical illness. It has been well documented in research that it's not just mythical in your head.
Well, whether someone's getting counseling services or they're in one of these residential programs, like how long would someone be in, like, the program or a program?
Yeah, in a residence it can vary. It can be, and by the way, these are all voluntary programs, so we don't take someone and say, you must stay here. And, it's not locked in the sense of you can't leave. It is voluntary, so anybody can leave anytime they want. What we find is there's a range. There may be someone who stays for, a few weeks, and there's another setting that works better for them. They may go back to their family or wherever, but, it can be short. There are some people who have been with us, a year or more. It really depends on the individual, how fast they're progressing, how their illness is progressing and responding to treatment.
Okay.
It's a very individualized thing.
And in this mental health component of all your programs, how many currently would you say are in that part?
Well, the clinic, as I said, is about 500.
Okay.
We have a day treatment program that serves about 125 people a day. Our residential component is about 90, so it's around 750 to 1,000 as people cycle in and out during the year. So it's about 1,000 people a year.
And for these non-residential services, where do they take place? Are they on the same?
Our clinic is at 500 Central Ave. Our day treatment program, it's actually called PROS, P-R-O-S, it's an acronym, but that is also located at 500 Central in the same building.
All right, so people in just the counseling, not the resident, they just would come, several times a week for their...
Yeah, and again, it's set up like any other doctor's office would be. When you begin treatment, you're going to be seen more frequently, so it might be twice a week. That's pretty common. It might be once a week, for some period of time, a month or 2 months or whatever, depending on what medications you're on, what your illness is, and that's a clinical judgment. After you're stabilized, the medication is working, you may be seen once a quarter. So it may be every 3 months, eventually. But I'm talking about the prescriber.
Yeah.
But in addition to that, you would also be seen by a social worker. We have a group of very talented licensed social workers on our staff here. And they would do the, what's called the talk therapy with people, but basically they're working on goals with people, helping them through the maze of difficulties in life that, all of us face, and helping them to work through that.
And the people you serve, is it all ages, all classes, all?
Yeah, our mental health services are adults only. We don't serve children, so it's 18 years of age and up. It's
across all.
It's really across the spectrum. We have 18-year-olds. We have, I don't know what the age of our oldest client is at this point, but I'm going to guess probably in their 70s.
Okay.
Yeah.
And I noticed you have a new program here working with college students. What's this called here?
Yeah, this is our Insights program. We've been working with the College of St. Rose on this for a number of years. We've received funding from the Mental Health Foundation, which is a group based here in Albany. They do funding for similar programs nationally. And what this is it's a way for us to help students on campus recognize a peer, another student who may be in need of mental health help. We work with their counseling center very closely. This grew out of years ago, the first incident that happened on a college campus where there was a horrific shooting, and it was the Virginia Tech incident. We realized that in hearing all the news reports about this, that often the people around a person who acts out in these awful ways, know something is wrong, but they really don't know what to do with that information. And so this program is an attempt to, better educate generally the student population, help people who may themselves need help, find the resources that they need to get help. So they may come to you
and say, so-and-so, I think, is having some...
Right, and then, we would work with the appropriate college people, respecting confidentiality and all the rest of that. It's not a reporting, it's not set up to be that. It's really meant to be a way of educating, peers about mental illness.
So what do you go to the campuses and do little presentations?
Yes, we do. We do.
Okay.
We, as I said, we work with their counseling center, who, by the way, are great, and we do education. Some of the things we've done, for example, are in the dorms. The RAs on the floors would work with us to put together presentations for the students. So at the beginning of the semester, they would have like a Sunday night get together.
Yeah,
I can't think of what
okay.
they called them, but basically the theme was mental illness, and they
Okay.
would, present the information in a non-threatening and interesting way, so that the kids would get educated about this.
You mentioned St. Rose. You only work with St. Rose?
Yeah,
or
we've been
SUNY?
working with, to some degree, on a limited basis, the SUNY
okay.
campus in Albany. Hudson Valley has been a big partner of ours as well.
Okay. Now, and this is a fairly new program, is it?
Yeah, it's been around for a couple of years. It's
Okay.
not well established as our clinics have been, but it's still fairly new, I would say.
So now I mentioned May is Mental Health Month.
Yes.
Do you have anything else going on for that? I see you're having a Facebook campaign or something. What is that all about?
Yeah, we're going to be posting more information on
Okay.
Facebook, and we post information on there all the time. I would encourage people to look us up and see what's going on.
Now, and you guys are a nonprofit, and I notice on your website people can donate. I'm sure not all your money comes from donations, but
Yeah.
how you guys are funded through various government agencies?
Yeah, we are a pretty complex
Well, I was thinking if you have 200 employees,
Yeah.
it must be.
Yeah, we have about a little bit over 200.
Okay.
Our annual budget is about $11.5 million,
okay.
which is a pretty sizable budget, and it comes from a number of different sources. Some of the sources are we bill directly. For example, the clinic. I'm going to come back to that again. We bill for those services the same way a doctor's office would. So we're
Okay.
billing insurances, and we're collecting fees from them. Our counseling center works the same way. Much of the money that comes back is billing for Medicaid services, so a significant piece of our revenue comes from Medicaid. We have other government grants that we get, that's another piece. And then we have private philanthropy, which are donations from the community, which we're very appreciative of.
Oh, okay. Well, that is for Mental Health Month. So I guess I should conclude with what you're both known for. Even though it's only May, are you planning for Thanksgiving now?
Yeah, we're always planning for Thanksgiving. It just never ends.
It's funny. When I mentioned to several people, I was going to be talking to someone from Equinox. Every single person said, "Oh, they're the people that do the Thanksgiving dinner." But
Yeah.
I'm saying, no, I didn't. I myself did not know you were such a large organization. It's really eye-opening to me. I mean, hopefully, the people watching this will get that too. So.
Sure.
And so that is equinox.inc.org. You can go to the website. There's all kinds of information for all their different programs. So, Dorothy, thank you for coming.
My pleasure.
Appreciate it. And we'll see you next time on Getting to Know You.